I am an optometrist and a practice owner in the rural northern parts of our great state, having office locations in North Conway and Berlin, New Hampshire, where I've spent the last 10 out of my 15 years practicing.
I have a Bachelor of Science in Biology from the University of New Hampshire and a doctorate in optometry from the New England College of Optometry in Boston. I am double board certified through the National Board of Examiners in Optometry and the American Board of Optometry. I live in Goffstown and practice in Manchester at New Hampshire Eye. By establishing a broad list of statutory exclusions which are outside of optometric training, and by granting the Board of Optometry the authority to regulate the profession within those exclusions, Senate Bill 440 aligns the profession of optometry with similar doctorate-level independent healthcare professions.
The list of exclusions that you're looking at, there are 262 surgical ophthalmic codes. 42 is how many of those would be permitted. There is a very large number of surgical ophthalmic codes that are still covered under that exclusionary list. And of those 42, 12 of them are what we are already doing.
While there is overlap between the professions of optometry and ophthalmology, we remain independent of each other. Yet, unlike all other independent doctoral level healthcare professions in the state, only optometry is required to pass legislation and to overcome opposition from a separate independent profession in order to be permitted to use our education and training.
I can tell you most critically why Senate Bill 440 is needed is due to a lack of access to care. A 2022 article from Ophthalmology indicates that the number of ophthalmologists in the United States have stayed stable since 1990.
This is not progressive or novel legislation. Optometrists have been performing the procedures permitted in Senate Bill 440 in dozens of states and for more than 40 years with safe and effective outcomes. 11 states allow electric laser procedures, 19 allow removal of eyelid lesions, and 41 have injectable authority.
The number of patients over age 65 will increase by 42% by the year 2030 and 83% by the year 2050, again, from their article.
I want to be very clear that nothing in this bill that is anything that's not covered in the exclusions cannot be allowed if it's not within our education and training.